Hey, good morning, everybody. It's Dr. Bruce Guillory here with Health Source Chiropractic in Atascocita, Texas. And today is I think it's officially the first day of spring today, March 20th, 2025. What a deal. And it looks and feels very springy outside today here in Houston, Texas, or Humble, Atascocita, Texas, which is technically where I am. And it's just going to be a gorgeous day. So if you get out and get a chance to get out and get you some of that sunshine and fresh air. You know it's one of the best medicines around. Ain't nothing but good for you. Do it while we can, because you know what's coming, right? Heat and humidity before too long. All right, so over the past few weeks, we've been talking about a couple of different things on these videos that we do that are rather unique. Of course, I'm a chiropractor, and the first thing I want to do for people with neck pain and back pain is I want to adjust your spine. That's what I do. It's what I love to do. Can't wait to get my hands on people's spines later today and get some people's spines moving better and getting them healthier. But oftentimes we get people that come in with sciatic issues, pain shooting down in their leg, numbness or tingling shooting down into their leg or their feet or their toes. Or the similar thing can happen in the neck, shoulder, and arm, where we have pain coming in from the neck and shoulder and radiating out into the arm and hand, or numbness and burning and tingling all through the arm and hand. And oftentimes those problems are related to herniated discs in the spine or bulging discs in the spine. And once we are pretty confident that that's going on, there's some specific treatment protocols that we use that get us some pretty phenomenal results. Just to step back a bit and talk a little bit about what herniated discs and bulging discs actually are. If you think of your disc as it's a shock absorbing pad in between the spinal bones. And if you think of it as like a jelly-filled donut, sometimes those outer fibers of the jelly-filled donut get injured and they become weak, and the jelly can cause a pressure on those outer fibers, and cause them to bulge backwards in the spine and press on nerves and create those radiating symptoms. Sometimes you can actually have a tearing of the fibers too, and the jelly is squirted out, and again pressing on nerves and causing pain that goes into the neck and the shoulder, the low back and hip or leg, what have you. And those are two conditions we see a lot of in our office. People that have had car accidents oftentimes have them. We just got an MRI report back on a patient yesterday from a car accident, a young guy, 21 years old, herniated discs in his neck. So he's going to be getting some treatment protocols that I'm going to speak about here in just a moment. And another lady who came to see me who's in her early 50s, and just her leg is on fire with pain. And so we did an MRI on her and recommended decompression therapy for her, which I'm going to talk about in a second. So I have always, with chiropractic and some exercise and things like that, been able to help a lot of people with herniated or bulging discs. But there was always a percentage that we couldn't help for whatever reason. Maybe it was because of just the disc was too far gone, or there was a lot of decay in the spine, or what have you, and those folks might end up having to go off to get surgery. Well, since we added in a specific protocol about 5 years ago, our numbers of people that we can't help with those sorts of problems has gone down by a good 50 or 60%, to be honest with you. And that one protocol is this table right here. This is a spinal decompression table, non-surgical approach to herniated and bulging discs. And we can do it for the neck, we can do it for the lower back. We had a gentleman come in to see us, we're in March now. I guess he started seeing us late last year in the fall time. And literally, my friends, when he came in, he's a younger guy in his mid-30s, I think, something of that nature. He could not stand up. He was walking like this, and he was walking like this for a long time. Even as he started feeling better, as we used decompression and adjustments and rehab on him, he continued to have to walk bent over like that. Well, this year, he's wrapping up some care with us, and now, since January, since I've seen him since January, he's walking much more upright and able to stand upright. And it's so awesome to be able to see that, because he was literally hunched over and walking in that position at the age of 30-something. That's just insane to think of someone like that. And we were able to do a lot of good for him, and he swears by this table here actually too. There's been a couple other people with neck issues and radiating arm symptoms that when we first put them on the table, they couldn't even get comfortable because laying on their back sometimes was just so painful for them. It was shooting pain down their arm, and they couldn't get comfortable. And within a few treatments, They were able to get comfortable, and now they're living normal lives, back to playing golf, those kinds of things. That's really cool stuff, because we're able to keep people from having to have surgical interventions so often, even if they have some of the nastiest, ugliest spines. There's been a few of those cases that have so much decay and degeneration all through the spine that I really wasn't confident that we were going to be able to help them, yet we were, because of decompression, because of chiropractic adjustments, and because of the appropriate rehabilitative exercises that we do. You know what? When people have disc problems, we also support them with nutritional supplements as well for the healing of the disc and the reduction of pain and inflammation while they're going through significant discomfort. So lots of cool things that we can do now for folks with herniated discs. So if you have a bulging or herniated disc, or you know someone who does, and it doesn't want to have surgery or doesn't want to try the injections, because if you do injections, man, there's risks involved with injections, plus the injection wears off. And so you're going to have to go get more injections more than likely. It may wear off in 3 days. It may be 3 months. We don't really know how long. Everybody's different, but sure enough, that steroid injection is going to wear off. And if the problem hasn't been fixed, the pain comes back. That's what this table allows us to do, is to fix those problems. How about that? Pretty cool stuff. All right, I want to remind everybody that we are continuing with Arch Madness for about another week and a half, I guess, here, where if you come in and you've got any back and hip problems, that we're going to be scanning your feet. That's always for free. We can scan anyone's feet for free. And if you need custom fit orthotics, we are taking 25% off of the normal cost of them, so it saves you some significant money. So Arch Madness is continuing through the end of March. So give us a call if you're looking for that. We're going to be in the office to see patients this afternoon starting around 2:30. Call us at 281-852-5600. And don't forget, tomorrow's half day Friday, so we're only going to be in until noon. You want to make sure you get in before that. We'd love to see you. Thanks again so much for the referrals you guys continue to bless our office with, and we promise we'll take really great care of them and honor that trust that you've put in us. Call us again if you need, 281-852-5600. Guys, have a terrific, thankful Thursday and a fantastic Friday, and we'll talk to you again soon. Hey, if you like this information, share it on your own social media platforms. I sure would appreciate that. Thanks, guys. Have a great Thursday.